Open a work session on House Bill 3090.
Mr. Chair, members of the committee, House Bill 3090 comes to the committee from Representative Reynolds, had its public hearing on March 21st. As introduced, the measure would prohibit the distribution, selling, attempting to sell, or allowing to be sold flavored inhalant delivery system products or flavored tobacco products, defines flavored inhalant delivery system product, flavored tobacco product, and characterizing flavor. The measure as introduced would have become operative on October 1st, 2023. I do want to draw the committee's attention to the -6 amendments. The -6 amendments exempts hookah lounges. It also permits a local government ordinance, rule, or regulation imposing more stringent requirements or prohibition on flavored inhalant delivery systems or flavored tobacco products. It also pushes back the operative date from October 1st, 2023 to July 1st, 2024, and then in doing so, it also removes the emergency declaration that was in the introduced version of the bill. With the -6 amendment, there have been both fiscal and revenue impact statements issued, and the measure has been requested in the measure has been requested, although it doesn't have a subsequent referral to the Joint Committee on Ways and Means.
Vice Chair Nelson, can I get a motion on the -6, please?
Chair Nos, I move to adopt the -6 amendments dated April 3rd, 2023.
Vice Chair Nelson moves to adopt the -6 amendment to House Bill 3090 dated April 3rd, 2023. Is there any discussion on the -6 amendment? Representative Morgan?
Thank you, Chair. I know we got the fiscal on this, and I guess I'm not understanding the rules of the building that when revenue is impacted at up to $176.9 million in the hole, that it doesn't require it to still go to revenue, because I guess it's only going there if it actually creates or extends or expands.
I think that's right. I think you actually understand it.
Well, I don't understand it. I'm just stating it.
Well, I mean,
So if we were creating a new tax, it would go there, but because we're eliminating revenue, it doesn't have to go there, is essentially what they're
I
saying.
think you're stating it correctly, yes. But because it will have a budget impact based on the revenue impact, it is going to Ways and Means for vetting.
Okay. I appreciate that at least it will go to the Ways and Means process. On the amendment, I do not understand how in the same committee we are eliminating in the same night age requirements on one bill and attacking a substance because kids cannot make that decision on another. At the same time, in this bill, we're excluding marijuana, which is already age restricted to 21, but kids are vaping marijuana or other substances, yet we're going to go after tobacco alone. I do not understand that we're going to trust kids with life-altering procedures medically, and yet we're not going to trust them to make a decision on tobacco. It's very ironic, and it doesn't make sense when it's already illegal. And when we heard out of Massachusetts, the financial and tax and health implications of their black market products coming to the state that were unregulated, and the financial burden to the state, why we would proceed down this path. I am sorry that we are, and I should acknowledge, I helped advocate for raising the age of tobacco to 21 when I was a county commissioner. It is age restricted, and I support that. But I also support legal adults being able to make that decision on the product that they purchase. Just the same as now that marijuana is legal, I advocate for people to make the wise decision that they can regarding alcohol or tobacco or marijuana as an adult should. We are taking that opportunity away from adults to make legal decisions because we say kids cannot do it on their own.
Representative Nelson, you want to try to follow that?
I'll withdraw my comment, actually. It doesn't need to be said.
Representative Deal?
Few comments. One, did anybody find a study that showed a flavored tobacco ban reduces consumption for children? Because I couldn't find one. You couldn't find one.
I think they did.
I'd love to see it, but I didn't see it. Another thing that this impact doesn't show, these folks have already paid the taxes on their inventory. So the state has to reimburse that. I don't know how many millions of dollars that is in taxes already paid on inventory they will not be allowed to sell anymore. So is that considered? I think it should be.
Representative Deal, I have not read in detail the revenue impact or the fiscal impact statement that we got. I suspect that somebody in Ways and Means is thinking about it, and if they hadn't, you've certainly raised it, and that'll be a thing. I believe part of the extension of the life of the product is to try to address some of that. Because I believe that people were moved by giving folks who have made an investment in this product, giving them the chance to sell it, I think is part of the thinking of pushing out the end date. I think the original end date was like October of this year, and now it's
Yeah.
going out to July of next year.
But there is no evidence that this is going to help kids. If there is, show it to me. Show it that it'll reduce use. But one thing it will do is it's going to drive a lot of businesses out of business. These are like, a lot of these are small businesses, first and second generation Americans. And they're going to get hammered by this. They're going to get hammered by it. In addition, it's a ban, I mean, everybody, not just kids, but people who smoke cigars once in a while. Pipes. I mean, what are we doing? Unless, of course, it's cannabis flavored. I don't get it.
Why don't we vote on the amendment? Unless anybody else wants to make a comment? Can I get a roll call, please, on the -6?
Rep. Bowman.
Aye.
Rep. Conrad.
Aye.
Rep. Dexter.
Yes.
Rep. Deal.
No.
Rep. Javadi.
No.
Rep. Morgan.
No.
Rep. Pham.
Yes.
Rep. Tran.
Aye.
Vice Chair Goodwin.
No.
Vice Chair Nelson.
Aye.
Chair Knows.
Chair Nuss votes yes. The -6 is adopted. Can I get a final motion, please, on House Bill 3090? Representative Nelson.
Chair Nos, I move House Bill 3090 as amended to the floor with the due pass recommendation, and that the bill be referred to the Joint Committee on Ways and Means.
Vice Chair Nelson moves House Bill 3090 to the floor with a due pass recommendation as amended, and that the bill be referred to the Joint Committee on Ways and Means. Is there any final discussion on the bill as amended? Representative Javadi.
Thanks, Chair.
Representative Pham? Okay.
Professionally, and clearly I have some problems with tobacco. It's horrible for people's teeth, it's for their health. I understand what the intent of the bill is, but I also believe that banning tobacco will be, not only is it an infringement on people's individual rights, especially adults, I don't know that it will go and accomplish the purposes that we want, which is to stop our youth from continuing to use flavored nicotine products or tobacco products. I'm encouraged by the evidence that shows that flavored inhalants like nicotine actually help reduce tobacco use among our adult population. I'm concerned about the fiscal impact, the revenue impact, but also the fact that that with that lost revenue, we'll no longer be able to provide. Well, we'll have less money for our public health initiatives to push back on this, to treat the ongoing disease that's going to be present from years of use going forward with this population that continues to use it. The drain it will be on our treasurer as we refund these taxes to these business owners, and just the business owners that are going to find themselves, like Representative Deal said, having invested their fortunes and their livelihoods into something that was permissible and is now not permissible. So I feel like we're going to create a black market, and we're going to continue to deal with this. It's just going to be in the shadows with no way to enforce it. And so for that reason, I am no.
All right. I'm going to Representative Conrad, then Representative Dexter, and then I'll let Representative Pham, who is the sponsor of the bill, have the last word.
Thank you, Chair. I appreciate it. Essentially just echoing the sentiments of some of the others. Significantly concerned about the revenue impact, significantly concerned about the impact to our businesses, particularly some of the smaller businesses, but more importantly, the impact to people and their right to choose. We have vices, we all have vices, and the impact for adults and the impact that's going to have on them being able to choose causes significant concern for me. So for all of those reasons, I will be a no.
Representative Deal.
I thought you were going to call on FAM, sorry.
No, I'm calling the sponsor last.
Okay.
You want to wait? I'll let Dexter
Yeah,
go.
yeah, go ahead.
All
Sorry.
right. Representative Dexter.
Thank you, Mr. Chair. So I just want to, I struggled with this bill because of the adults making decisions. And I think foundationally what drove me to come to the decision to support and even be a sponsor are the data. And to your question, Representative Deal, we know that there is a very statistically significant predisposition for youth and emerging youth who smoke, or I'm sorry, who use vaping products, that they then go on to be smokers at almost 7 times, those who don't use flavors. And that was, it's compelling data, and that honestly was what swayed me, is that I see smokers every day. It's the hardest thing that most people have said that they've ever had to quit. It's habitual, it's physiologic. There are so many different reasons that if we can't help curb the long-term implications and impacts of smoking, I think that we really are doing ourselves some harm as well as our youth. So that is foundationally why I think the interest of the future of our healthcare system is deeply impacted by smoking and tobacco. And I also struggled for exactly the reasons, Rep. Morgan, that you talked about, that we're removing choice when we're also giving it in other things. And foundationally, I think it's the cost to the system, as well as that the youth predisposition to smoking in the long term is compelling enough to make that choice. So thank you, Mr. Chair, for allowing me to say something.
Representative Deal.
Thank you, Chair. Responding to the vapes, I understand that study, but it doesn't say that if you ban them, kids won't use them. How many people here use things that you weren't supposed to use when you were a kid? It really
My
didn't
mom
stop
watching?
me.
I'm sorry.
It really didn't stop me. The other thing on the vapes, the UK, I've read their studies, it's a harm reduction tool in the UK. It seems pretty effective, at least their National Health Program thinks it's effective. And I'll emphasize, it's going to create a black market. They'll still be able to get it. It's just going to run some good people out of business.
Okay, before I let Representative Pham, who's one of the sponsors of the bill, have the last word, is there anybody else that wants to make a comment? Representative Tran.
I am going to choose the kids over the small businesses. As a small business owner, we're very agile, and we get to make decisions based upon our values. So I choose the future generation's health and well-being over profit and money for our state. We'll figure it out together, but we're going to save our children's future with this and their health.
Representative Javi, one more time.
Yeah, sorry, wanted to also add that the bill really targets products that are only really used by 2% of our youth. So I wonder if we really will see a reduction in flavored tobacco use in general among our youth, and instead cost ourselves hundreds of millions. Like I said, I think we're just going to go back to a black market. We're going to have the same problems. Now we're going to have less way to enforce it, less way to pay for the negative outcomes. It would be great if we could wave a magic wand and it was gone and everyone no longer wanted to use nicotine and they moved on to something else. I just don't think it's possible. And I think protecting freedoms, which sometimes means we give people the freedom to choose good health outcomes and bad outcomes, is worth is priceless. So I'm going to continue to decide with voting no. Thank you, Chair.
You're welcome. Representative Pham, you have the last word.
Great. Thank you, Chair. Well, I want to put this bill into perspective as we get ready to vote. Last year, more than a quarter of Oregon shops that had uncovered decoys failed that test. If you break that down, 23% were convenience stores, 7% of them were tobacco and vape stores, and grocery stores were at 37%. And so with that said, there are 2.5 million teenagers across the country that vape, including 1 in 7 high schoolers. About 85% of these teens are using flavored tobacco products. 1,800 Oregon kids start smoking every year. If we don't act now to address this public health crisis, potentially 68,000 kids will die prematurely. HB 3090 gets at the root of this problem by disincentivizing teens from starting to smoke by restricting the sale of flavored tobacco products. Essentially, if you make it almost impossible for these kids to get, it's going to be very difficult for them to get it. Sure, there'll be some that get their hands on it somehow, some way, but that's always the case. But if you make it very difficult, it's going to be a lot harder for them to start the addiction process. So I truly believe at this level, if we take action, we protect our youth and ensure their health for years to come. And I'm with Rep. Tran that we put our kids first over profit. So I urge a aye vote HB 3090.
Can we have a roll call, please, on the bill as amended?
Rep. Bowman.
Aye.
Rep. Conrad.
No.
Rep. Dexter.
Yes.
Rep. Deal.
No.
Rep. Javadi.
No.
Rep. Morgan.
No.
Rep. Pham.
Yes.
Rep. Tran.
Aye.
Vice Chair Goodwin.
No.
Vice Chair Nelson.
Aye.
Chair Knows.
Chair Nuss votes yes. The bill as amended is adopted. House Bill 3090 is on its way to Ways and Means. It will be, I'm sure, hotly debated there as well. With that, I close the work session on House Bill 3090.